Mental illness. It comes in many different forms. But how is it treated? Okay, so everyone take a deep breath in and hold it for 5, 4, 3, 2, 1, and let it out. Feel all your anxiety melt away along with your troubles. Now, is your stress still there? For years, mental illness, which by simplest terms is known as disorders that affect your mood, thinking, and behavior, was seen as some Satan-caused condition that could be purged with hot baths and med overdoses, much like American Horror Story Asylum.
No, God damn you, let me go! This is Satanism!
Quite the contrary. You've exhibited clear-cut signs of manic depression, for which electroshock therapy is the prescribed treatment.
No!
Jeez, it was a horror story. However, while the Mental Health Care Act of 1963 deinstitutionalized the majority of U.S. asylums, it was not just a story. Negative attitudes towards mental illness in the 18th century in the United States led to stigmatization of mental illness and unhygienic and often degrading confinement of mentally ill individuals. Because of this, it was also thought of as a shameful situation for all those involved. Even now, when we know that this is not the case, many of us still act with an overwhelming stupidity towards the subject. No, deep breaths and yoga cannot be considered treatment. And yes, we have stopped the ridiculously inhumane techniques of the old and have tried to make access to proper mental health care more readily available, but we still aren't at 100%. Unsurprisingly, millions of people are diagnosed with mental illness each year. In the United States alone, though a shockingly high amount are not getting the care they need. While this is obviously due to multiple factors which could vary case to case, people like this guy don't help.
I think bipolar is like the latest fad. Everybody and their brother is getting diagnosed with bipolar. And last time I checked, we all have good days and we all have bad. And I don't consider that an illness, and I don't consider it a disability.
Does stupidity just come naturally to this guy, or did he get hit in the head with a rock as a baby? Can someone please tell Mr. Tom Sullivan, radio host for Fox News, that bipolar disorder is a mental illness and not the latest detox protein shake? The sad thing is that there are many people out there who believe as he does, and while many also want to help improve our mental health care system, without enough support, it just cannot happen because of issues preventing them from it, such as lack of general awareness, shame and fear of harsh stigma, and high, ever-increasing prices. When mentally ill people are unable to get their own help, the government doesn't know what to do with them, so they stick them all in prisons. It's like how we stick our retired grandparents in nursing homes. It's okay, Nana, nap time's at 4. And if you can't find your teeth, just call the nurse. Though in all seriousness, many prisons are poorly equipped to properly deal with mental illness. Inmates with mental illnesses are more likely than others to be held in solitary confinement, and many are raped, commit suicide, or hurt themselves. This obviously is a pressing issue, but it becomes more so when you learn that in 44 of the American states, prisons house more mentally ill people than the largest psychiatric hospital in the state. And to give even more context, in total, there are 10 times more mentally ill people in prison than in actual mental health care facilities. Not only is this insane, but it means that instead of receiving proper health care, they are placed in jails or prisons that can't offer them the care they need. Now, this may be because their illness can result in reason for incarceration, but lack of mandatory crisis intervention training also plays a role. If law enforcement was able to recognize the difference between an actual criminal and someone in need of help, psychiatric hospitals would be better able to do their job, cutting down the number of mentally ill prison inmates, as well as increasing the number of treated patients. Furthermore, the amount of patients in mental hospitals is at a new low. With their highest peak in 1955, state mental hospitals held 558,922 patients. Today, they hold about 35,000 patients. And this is not because there are less mentally ill people, but because more people are simply not being treated. Now, the stigma also plays a huge role in whether or not people choose to seek out help for their needs. However, The denial of those around them can be quite discouraging when it comes to lack of support, and when said, denial is preventing certain people from accepting the facts. Now, let's say hi to our good friend, Tom Sullivan.
What were these people called 25 years ago?
Well, you know what?
Before they came up with this bipolar diagnosis. I mean, I just think it's something's made up by the mental health business just to be able to give people prescriptions and keep them coming in and keeping you paying them money.
Oh, good God. Who in the deep depths of AM radio hell lets this man share his opinions on air? And yes, that is the same idiot of a radio host as before. And I know what you're thinking. What possible credibility does this man even have? Well, the answer is none. That's right. Tom Sullivan, who has no education when it comes to mental illness, is trying to deny that bipolar disorder even exists. In fact, he was a frat boy that studied math and business. It is a shame he can't mind his own, right? But think, a radio host who is paid to talk doesn't even know what the hell he's talking about. And while that poor bipolar woman tried to use reason with him, there was too much bullshit coming out of his mouth for him to hear her. Though, there is a large portion of the population that agrees that mental illness is not a serious issue, there is also a devastating amount that would rather not associate with a mentally ill person, further contributing to the shame and stigma preventing people from getting proper care. This graph shows the extent of unwillingness many Americans have to accept the mentally ill. But understand, mentally ill people are going to be our neighbors. They are going to marry into people's families, and they are going to have friends and coworkers. They're still people. Being unwanted or believing that they are unwanted is going to do some harm, and perhaps this is why many choose to stay silent. If 68% of people wouldn't want you marrying their cousin because of your mental health, you'd be a bit bummed, don't you think? What if 38% of your neighbors didn't want you living next door? These statistics are so sad, but they can also seriously dishearten those in need of mental help. Another setback of the mental health care system is its prices. Many people with mental disorders are unable to pay for care and do not receive help. A study from 2016 shows that mental health care costs have risen 3.4% since 2015, stating, medical health care costs altogether rose 1% just in August from July, according to the Consumer Price Index. Jeez, America. Of all things to overprice, help for the mentally ill should be a priority to remain affordable. Another study conducted by the Agency for Healthcare Research and Quality claims that individuals nationwide spent an average of 10% of their family's annual income out of pocket for mental health care / substance abuse treatment. So clearly, money is an issue here. People with mental disorders are born with these conditions. It's not fair for them to be financially burdened with these issues as well. These people deserve an opportunity to be successful just like the rest of society. So why charge them such a large percentage of their income? A woman named Karen Kelly describes her story regarding mental health care and its setbacks.
Knowing she needed help, Karen decided to overdose on medication to get emergency treatment.
Came out to my husband and said, I just found a whole bottle of nortriptyline. Do you think they'll take me to the hospital now?
This poor woman overdosed, hoping they would give her emergency treatment. Lives are in danger because of the setbacks of the system, and it must be fixed. It's not like we as a nation are using the money for more important things. I mean, what could be more important than the mental stability of our civilians? Oh, I know. Netflix and Starbucks and Kylie Jenner lip kits. Oh, and also, there's literally lethal weapons being sold for less than the price of mental health care. It's baffling that people are denied help regarding mental illness, but can easily buy weapons, which often result in murder or suicide. According to the Brady campaign to prevent gun violence, 40% of guns sold in the U.S. are still sold with no questions asked. You could be selling a gun to a convicted felon, or even a minor still enrolls in high school. Something is definitely wrong if people are being denied mental health care, while guns are practically handed out like candy on Halloween. Also, the National Alliance on Mental Illness states Connecticut's public mental health system currently provides coverage for less than 1 in 5 Connecticut residents with a serious mental health problem. The other 4 out of 5 people are unable to afford the care. Clearly, people with less money are even more of a disadvantage. If you think about it, having a mental disorder does not look pretty on paper when applying for a job, so it makes sense that many of these people are already financially impaired. If anything, the government should go out of their way to assist these people with obtaining the care they need. Surprisingly, people argue that we should prioritize physical health over mental health. They presumably believe it's less important to address. Researchers found that doctors had a lack of depression care management from primary doctors. The doctors do not see depression as a huge issue, even though it is life-threatening. That's like saying water by itself isn't as necessary as food and isn't essential for survival. Sounds good to me. I never really liked water anyways. I'll just live my life on Cheez-Its. Their claims have been countlessly disproven, though. An associate director of the University of Michigan Comprehensive Depression Center stated that treating mental health problems not only reduces individual pain, but it actually has an impact on physical health. So not only are people denied mental health care, but the denial itself builds to additional health issues. Therefore, healthcare is as much of a priority as any other health-related treatment. The issues of current mental health care are essentially self-proven. People are suffering across the nation because of the mental health care system prices, associated stigma, the effects of not receiving help, and the lack of awareness. Prisons are filled with mentally ill inmates solely in need of help, yet unable to obtain it. Guns are placed in the hands of the mentally ill, not the care they need. People who claim that mental health care is not a priority are simply misinformed and should not have these people's fates in their hands. Something must be done about this pressing issue. Though essentially the most effective change is in the hand of the government, everyone is capable of helping out. The people with mental impairments must be treated as equally as the rest of us, and they deserve the help they can get. There are many organizations dedicated to providing mental health care services to those not necessarily able to pay on their own. Anyone is welcome and encouraged to donate to these nonprofits. One in particular is called Mental Health Care America, which strives to provide help for anyone in need of it. Please donate. Everyone is capable of making a difference in this serious issue. Thanks for watching, and see you next time.